Hello, my friends. This is Dr. Samuel. I want to talk to you on this question about the matter of acute urinary retention. Here you have a man usually above 50 years, usually older, who comes to the hospital in pain, painful distress because he hasn't been able to pass in the last in the several hours up to then. Okay, if in history he could tell you that he's had a difficulty passing urine, he had to strain at urine, that he had to wait when he goes to pass urine for a few seconds, for some seconds before urine flows, that he has that the urine stream is poor, it scatters, or that he may have passed blood in urine, or that most commonly they will tell you they wake up often at night, multiple times at night to go and empty their bladder. Or he will tell you that he has frequency, that means he goes to urinate frequently, more frequently than usual. Okay, so this patient, when you examine the prostate, during the rectal exam, you find that it's enlarged. It could be smooth, uniform, and enlarged, or it could be nodular. And then what you have to do, what the person needs is quick relief from his distress. So a foolish catheter is passed in the urethra to drain the bladder, and the person you see immediate relief on the patient. But the next step then will be to determine if this prostatic enlargement is benign or cancerous. So the next step that will require a biopsy to be done. Also, you want to see the PSA. The prostate specific antigen. You want to see it, okay? So at the level it indicates normalcy to an extent of any reason it indicates benign enlargement, and beyond the level it indicates a malignant cancerous enlargement. So that is done, and then also a biopsy, a prostate biopsy is done to make a conclusive decision on whether it's a benign prostate enlargement or a cancerous enlargement. Also, it's good to remind that something like an alkaline phosphatase could help determine, and an X-ray could help determine if an X-ray of the pelvis and the femur could help femurs will help determine if there's metastasis, okay, to the bones. And then acid phosphatase is an enzyme that also comes from the prostate. I feel like it's no more in vogue these days when PSA is used, but acid phosphatase usually indicates a cancer of the prostate. Okay, so depending on the conclusion, if it's a benign prostate or a cancerous prostate, then the treatment will follow accordingly. If it's a benign prostate, then the patient will have to be on an alpha-1 specific adrenergic blocker like tamsulosin or doxycycline, and also an anti-testosterone medication like finasteride. That will help restrain the prostatic enlargement, and they also relax the muscular tissue of the prostate, so that the patient can pass urine. If it's a cancerous prostate, then that follows other steps. Okay, all right. Okay, that will usually include if it's actually okay. Well, that it depends on sometimes it may require watchful waiting to determine, because it can be a little bit complicated to determine whether a patient has malignant cancer of the prostate. It can be quite challenging Sometimes you may see a patient who indicates who seems to have cancer on the prostate, but he doesn't progress to have symptoms for years. Okay, so usually this part of the care will be left to the urologist. Okay, and such patients may require oculectomy or chemical castration. Thank you very much.